Hello, today I want to talk to you about your client paper. Many of you have already gone to see the library and the writing center and are trying to get your first written paper underway, as it is soon due. Well, I've also received some stressful, maybe, questions about how do you go about this. So, one of the things that I think it might be kind of difficult for some people in this particular class is that since it's a clinical research class, clinicians that are in the class seem to go about it from a clinical brain and start thinking about case notes and progress notes and presenting problems from a clinical standpoint. So I'd like to try to shift your brain to a research-oriented one and say what you're trying to do for everything in this class, but ultimately for your clients, is find out what works for them to help whatever their problem is. So their presenting problem, clinically speaking, is different than their presenting problem in research. Let me explain. From a clinical standpoint, you'll have your client walk through the door and say, this is why I'm here. And that's their presenting problem. But when you're actually getting into their treatment, you might be treating something that's the deeper issue, that isn't why they walked through the door. Why they walked through the door were some symptoms that are clearly related to that deeper issue. From a research standpoint, you want to make sure that you are researching what is best to make them better. So that's the underlying issue, the bigger issue, which we're calling the social problem. And I'm trying to get away from using that word, the presenting problem. So their deeper issue has research behind it as to how to make it better. And that might differ depending on the population of the person. So let's say that what somebody comes in with is, I'm going to use an example from one of your classmates. They're coming in with the issue that they are overeating, and they think it might be related to stress. They're not quite sure. And you ultimately dive into anxiety. And one of the pieces of their anxiety, or one of their coping mechanisms, is overeating. So you want to do all of your research on anxiety, and ultimately you're going to find risk factors and comorbidities related to anxiety. And I'll get to those in a second. And you would like to make sure that you're finding the best treatment for this particular client related to anxiety, but that could also benefit this symptom that she's experiencing as well. And let's say this is a female client who is 50 years old and is a certain ethnicity. You'd want to make sure that you're looking into all of the demographics that go into that. So risk factors, it sounds like everybody's at risk for all these things. That just means who most often experiences these things. Comorbidities. What also tends to go with these things? So let's say that you think you'd like to study anxiety. Well, a lot of people are studying anxiety. That makes sense. Let's see what risk factor or what comorbidities you would like to kind of specialize in. So I know I'm kind of all over the place with this, trying to give you different examples that might speak to you. But let's say that you are working in a school. So you're working with a younger age group. And anxiety is something relatively easy to identify, but your client is experiencing OCD and anxiety. You would like to make sure that your treatment is something that would help with both of these things, but you're picking one main issue so that most of your research is on that main issue. So let's say that is anxiety. So when you get past the client paper and into your literature review, you're going to research anxiety. What is done about it? But then make sure that you also have a section of your literature review on anxiety as it relates to OCD, so that you can best find the treatment for this client. They're not a 75-year-old Vietnam veteran who's experiencing anxiety as it relates to PTSD. They're a 15-year-old student who is experiencing anxiety as it relates to OCD. So make sure that you're focusing in on your particular client issues as we go along. Now, to go back to the client paper, this is just a first stab. You can change this. So the client paper is meant to be an academic paper, kind of brainstorming about this client. It can be a real client. I find that it actually works somewhat better if it's not, so that you can mold this client to your needs as you go along. If you choose a real client, at some point you get stuck because we're not actually doing the research. And you say, well, what actually happened to this client? And I don't know. But you could go either way at this stage of the game. This is just to identify what social issue really interests you and how the client experiences it. So in this paper, please separate out and write it in full sentences, APA format, essay format. I don't want client X presents anxiety, came in with this. I want it to be written out like you're giving a full description. This isn't a client case note. So you're going to want at least one paragraph about all the demographics so we understand what your research needs to entail. And then another paragraph about the issue. How does this client experience it? And what else might be related? How is this client describing this issue to you? And ultimately, make sure you're following APA format. Correct spelling, full sentences, paragraphs, all of the above. Now, one of the things that I like to advise my students in this particular class is start to think about what you want to be an expert at when you finish. I know it's only a quick 8-9 months away, but do you want to be an expert on anxiety? Do you want to be an expert on PTSD, on autism spectrum disorder? Whatever you would like to be an expert on as you enter the job market with your master's degree in May, that's what I think you should choose now. So you start to do the research. So by May, you've done, could be 10 different assignments on this issue, and you will know it so well that you will be an expert on this issue. If that's anxiety, fabulous. And for each assignment, you might go into a different aspect or a different comorbidity or different population. But you will have read by the end of this everything that's out there on what we do, what we know about anxiety. And that goes for anything else that you would like to study. Okay, that's it for now.